about apart from exercises, what about diabetes? How does diabetes affect your eyes, and how does lowering sugar is going to affect the eye health?
Yeah, so that's a very important question. Diabetes can have huge consequences on the eye. Basically, there are various things that diabetes can cause on the eye, which includes early cataracts, and changes in the refractive error. But what really we need to worry about with diabetes, and what is the most common and what is the most disastrous at times, is diabetic retinopathy. So our retina, the nerve of the eye, has a lot of blood vessels. And diabetes, as you would know, is a disease of blood vessels. It affects the small vessels. And so the eye is no exception. What happens is it starts prolonged uncontrolled diabetes leads to damage to these blood vessels. So they start becoming leaky. They start leaking blood. They start creating these small microaneurysms or blood clots. Then you can have swelling of the retina that can develop. Uh, and after that, all of as a prolonged phase, there can be abnormal blood vessels that develop in the eye because of diabetes. And those blood vessels are leaky, they create scars, they can actually cause your retina to detach. So again, with diabetes you can have permanent loss of vision if your blood sugar levels are not controlled. And again, so for diabetics, essentially extremely important to get a dilated retinal examination. Are you aware what dilated would mean? Dilated means you have to put drops, dilate the pupil, and then take a look at the retina every year. And if there are signs of any swelling, signs of any abnormal vessels, then those have to be treated with injections or with lasers. And in people who do develop a detachment of the retina, you might need surgery. And the outcomes are not as great as, say, with a cataract, because if you had a lot of damage to the retina, you might have a significant amount of permanent loss of vision. So most important thing is to keep your sugar levels under control. And it's the eye is also a window to your body. So if you have damage in the retina of the eye because of diabetes, you're also likely to have damage to your kidneys and to your other organs. So extremely important to keep your sugar levels under check. Extremely important for diabetics to get a yearly checkup, because diabetic retinopathy can be disastrous and needs to be detected on time.